Hi everyone, Dr. Remy from Pain Free and Fit and Posture Size. Today we're going to go over the top 3 exercises you're going to want to avoid if you have patellofemoral pain syndrome. It's going to help reduce the stress to those knee structures and help you stay out of pain. Hope you enjoy it. So what we have to keep in mind with patellofemoral pain syndrome is that the pressure underneath the kneecap is going to be greater the more of a bend we have in the knee. And that's going to be associated, of course, if the knee bends straight down, or particularly if the knee moves forward and moves over the toe line. If I draw a line straight up from my toe, if my knee goes forward, that's going to increase the pressure. And that then is going to grind that kneecap into your intercondylar groove, and that's going to aggravate patellofemoral pain syndrome. Now, before I show any of these 3 exercises, you want to make sure that you do a body analysis on yourself so you know your unique postural problems. We have that body analysis on either the Pain Free and Fit or the PostureSize.com websites. If you learn your specific unique postural and mechanical problems of your ankle, of your hip, of your knee, you're going to be able to utilize those corrections with the modified exercises I'm going to share today, which will really help you stay out of the most amount of pain. Remember, you never want to just do generic exercises without thinking about what your own unique issues are, because otherwise you're only strengthening your musculoskeletal dysfunction and abnormal mechanics, which lead to more stress and injury. We want to develop proper function and corrective function based on our unique problems. So once we understand our mechanics and we're going to be learning how to squat and lunge and move correctly, we want to avoid the following situations. With squats, which is the #1 exercise we're going to talk about, and lunges, we want to make sure we have more of a hip backwards motion. Do you see that? As opposed to a hip down motion. As I bring hips down, it brings my knee forward. That increases the pressure and compression underneath the kneecap. Again, if I have any unique problems, I want to make sure I'm tensing my kneecap in. I want to make sure I'm taking care of any hip or foot alignment problems. We have plenty of this in the different videos that we share on our websites. We also want to make sure in a lunge that we have a far enough stance from front to back so that as I descend in a lunge or a split squat, my knee is bending, but similar to the squat I showed, is not traveling forward. A lot of people that do lunges or split squats, they're driving that knee forward. That's putting a lot of pressure underneath the kneecap and aggravating our patellofemoral pain syndromes. The second exercise we want to avoid are supine leg lifts. Most of the time with patellofemoral pain syndromes, we have an overactive hip flexor, particularly the TFL, and that's helping to drive our kneecap laterally, which is compressing those kneecap structures. So as opposed to doing leg raises like this, we want to make sure that we drive the hip bone, or the greater trochanter of our leg, backwards in the hip socket to bend our knees. A lot of people do leg raises, they don't know why their knees are hurting. They think this doesn't have anything to do with my knee. It has everything to do because you're overloading your hip flexors. So using the buttock muscle on that side by creating some tail under tension, and if you feel the side of your hip bone, the hardest aspect of it, if you contact the front of that aspect and the back portion of that hard ball or greater trochanter, you'll feel more pressure by squeezing the buttock and drawing that hip downwards towards the floor and less pressure into your forward finger. Again, that hard aspect is your greater trochanter bone. It's about the size of a golf ball. You just feel the front of it with one finger, the back of it with another, and as you practice hip flexion, which is bending the knee, make sure you're using the buttock squeeze on that side with a little tail under tension to help engage that, so that that hard ball moves downwards into your finger and away from your top finger. That's a huge exercise in learning how to walk correctly, climb stairs, is learning how to flex the hip or bend the knee by having backwards pressure in the hip socket, which reduces the stress on the tensor fasciae lata, iliotibial band, and thus the outward pressure on the kneecap. And then the last exercise we want to talk about to avoid patellofemoral pain syndromes is the act of walking. And when we walk, we typically, if we hit with the heel out, it has a tendency to have more of a pronation in our foot, meaning that as I step, if my heel hits first, as I come down, and if I have a tendency to pronate or have my heel move inwards, that's going to rock my whole knee joint in, creating a valgus or knock knee posture, drawing the kneecap outwards as the rest of the knee moves inwards, and that's going to aggravate patellofemoral pain. So whether you're a runner, whether you're walking on the treadmill, doing the elliptical, you want to make sure that you hit with more of a mid-stance contact, where your entire foot is planting on all four corners upon contact, rather than a heel contact. That's going to help you engage a better mechanical advantage at the knee, especially as if you hit, you think you're standing tall on that leg. Okay, so in the normal cycle of running, of walking, of treadmill use, of Stairmaster, elliptical use, as you hit on all four corners, you'll notice my ear, shoulder, and hip are all above the foot. The foot's landing on all four corners, and I'm driving my hip down and rib up. That engages the proper hip abductors like the glute medius, sparing the tensor fasciae lata and the stress imparted to the knee joint. So keep those 3 tips in mind when you're exercising, working out, and you'll have to avoid a lot of aggravating stress on your knee joints and help to improve your patellofemoral pain syndromes. Hope you enjoy. If you like this video, give me a thumbs up. We'll make sure we drive it up in the ratings and help more people understand their knee pain and get out of their discomfort. Again, if you have any questions, always feel free to leave me a comment below. I'll do my best to get back to you, answer those questions, and help you get pain-free and fit.